Hi, my name is Dr. Suzanne Halt. I'm a certified nurse midwife at Valley Perinatal. I've been with Valley Perinatal for about 8 years now and done maternal fetal medicine for almost 19 years. I've been a midwife for 23 years now, but I do love high-risk OB the best. When I was pregnant with my second daughter, I had a very complicated high-risk pregnancy, and I started working alongside Dr. Elliott during that pregnancy to sort of help get me through. And I thought that being a midwife and being pregnant and seeing a different side of OB practice was very interesting. And it was great for me to see how moms in my particular situation who were really struggling to maintain their pregnancy and to have a healthy baby were so completely cared for, and it felt like we had a place to go where our questions were answered and our situations were cared about by people who had the education and the experience and the knowledge to kind of step out on the edge with us and kind of hold us there and hope for the best with us. Most of the patients I see are diabetics, whether they be gestational diabetics, type 2 diabetics, or our type 1 diabetics. Those are the folks that I see most often in the clinic. I also see patients in the hospital and help with cesarean sections at several of the local hospitals. The most common concerns and conditions that I treat again are diabetics. Those probably take up the bulk of my patient load in the clinic. I will also see anyone else who frankly gets on my schedule. I'm lucky enough to see whether they have autoimmune diseases or complicated pregnancies because their babies have complications or other medical conditions that bring them to Valley Perinatal. I'm happy to see everyone, but most of the folks I see are diabetic patients. Every patient is different, every patient situation is different, and sometimes it's challenging to remember that when we're in the thick of managing high-risk conditions, especially when we're managing diabetes and we know that mom's blood sugar directly affects the baby. And we can sometimes butt heads a little bit trying to get better blood sugar control because there are a lot of things that affect blood sugar control, and not the least of them is mom's ability to afford healthy foods. And some of our moms just don't have that ability. And so oftentimes we're trying to kind of meet in the middle and find a spot where we can do the best for moms and the best for babies with all of the abilities that we have, moms and babies and us together. We always try and help patients be involved in their care decisions by asking them questions about things that they can do or things that they're not able to do that can help us meet in the middle and create the most effective care plan for that particular patient. The most common reason that folks come to see me is to help manage their blood sugars in pregnancy, whether they have gestational diabetes or diabetes that predates their pregnancy. I am often on the phone, whether it be telephone, text, sending emails to folks' OB providers to let them know how their office visit went when they were in to see us, what their baby looks like on ultrasound, any changes in their medication plans, and when to start testing, and then, of course, when to deliver our patients. So we talk quite a bit. In fact, my phone rings all the time, all day and all night. So we talk all the time. When you come to see me, we often will talk about fun and exciting things like what you're eating and how great you are at counting carbohydrates, and then really kind of the meat of the matter, where your blood sugars are and where we need them to be. We'll review your baby's ultrasound measurements to let you know how well your baby's doing based on blood sugar control. And then probably we'll do some not fun things, like take some things out of your diet and talk about that nasty E word, exercise, and see if we can get some of that going to help manage blood sugar control. Sometimes, in all fairness, our first visit's not great because nobody likes to manage what they're eating in pregnancy. Our hope is always that we can eat all the things that we want and all the things that we crave. And when you come to see us, because your blood sugars are not great in pregnancy, those are some of the things that we talk about first. And it's not always great, but it's not because we don't want you to have the greatest pregnancy outcome. Come to see me, come with a positive attitude. Sometimes we don't do the most fun things, to be honest, but it's all to get the best outcome. Bring your blood sugar logs, bring any questions that you have, bring your glucometer if you're not sure that it's working correctly, Make sure that we're able to download your insulin pump or your CGM prior to coming to your visit. Bring your family, your friends, if they want to come with you, if they have any questions, and if they're supporting you through your pregnancy, they can be invaluable at your appointments.